Welcome everyone to the 2021 MQ Mental Health Science Summit. The MQ Mental Health Science Summit is one of the largest international meetings dedicated to mental health science and to the community needed to tackle the biggest challenges in mental health. The purpose of the summit is to bring together different people from across the spectrum of clinical research and lived experience practices. The goal of this summit is to use science to transform lives of people affected by mental illness and to make huge leaps and accelerate progress. We hope to do that by focusing on some of the biggest issues of mental health today, intersectional dialogue between a range of key perspectives, and showcasing cutting-edge innovation to harness its potential and enable the sector to take those leaps forward. We're delighted to be jointly organising this year's summit alongside Wellcome. There are four main sections that we're going to cover over the next 2 days of content. Firstly, we'll be looking at COVID-19 and mental health research. We'll then be having rapid-fire talks and keynotes about mental health science, moving on to our focus on children and young people's mental health, and concluding by looking at mental health science and inequalities. Lived experience is a critical perspective for mental health science. This expertise by experience goes beyond simply experiencing something, but actually using that experience to generate key insights that inform research and practice. It's a critical means of knowledge generation and an emerging discipline in its own right. At this year's summit, we'll be including expertise by experience in a number of different ways. You'll see that all of our sessions are jointly chaired, with at least one of those chairs having substantial lived experience. We also have a group of young people who'll be watching all of the content on the children and young people's theme and giving their commentary on what they've heard over the period of that session. We'll also be on social media, and we are really pleased to be live streaming from Mental Elf, who will also be including two guest tweeters, Pookie Knight-Smith and Dr. M. McAllister, both with lived experience. As you'll all be acutely aware, there is the small matter of a global pandemic, and so this summit for the first time is being done completely virtually. The team and I are actually here at the Royal College of Physicians, and we're really thankful to the team helping with all the technology today. And I suppose in a virtual hybrid world, there are both advantages and disadvantages to this kind of event. One of the big advantages is in terms of accessibility. We're joined today by delegates from across the globe in different time zones, and we're particularly thankful for Wellcome's support for bursaries to support delegates who are either early career researchers from low and middle income countries and have lived experience. We have worked hard to get an agenda for you that is snappy and punchy and hopefully gives you a little bit of time to get away from your screen. Do feel free to take the breaks that you need in the process. We will be talking later about how we've still managed through the RCP's platform to get posters and networking opportunity, and there'll be two dedicated sessions for that, one at the end of today and one tomorrow morning. If you want to join in the conversation, then do feel free to tweet what you're hearing and some of the highlights from the talks. We'll be using the hashtag MQ Science Summit, and if you follow the Mental Health stream on Twitter, you'll be able to see some of the comments there from those with lived experience. That hopefully covers all the logistics. I don't have to tell you where the bathroom is or what to do in a case of a fire, because that's all on you for a change. Again, an advantage of a virtual event. So without further ado, let's get into our first topic. The first focus of this year's summit is to look at COVID-19 and mental health research. As we move in the pandemic in the UK from being a pandemic into an endemic situation, mental health is once again a huge need. Mental illness was a crisis long before COVID-19 came along. But what the events of the last year have done is to shine a spotlight on mental health. They've increased known risk factors for mental illness and led to rising rates of mental illness. And we need solutions. MQ is focused on research that will move the dial on mental health and go beyond counting and characterising, and to use that knowledge to generate solutions that interrupt trajectories and change lives. The first session of this opening topic we'll be looking at COVID-19 and mental health research with reflections from Emily Holmes and Ed Bullmore from a recent MQ Academy of Medical Sciences workshop that took stock of progress over the last 12 months. Some of you might be aware of the paper in the Lancet Psychiatry published back in April 2020 calling for action in a multi-disciplinary approach to the pandemic. Now moving out of this initial emergency into the new phase of the virus 12 months later gave us a key opportunity to review progress and set priorities for the next phase. The meeting took place about 3 weeks ago and a report will follow in a few weeks of all the discussions that were had by well over 70 individuals from across academia and lived experience, as well as incorporating all of the major mental health research funders. We have an opportunity, however, before the paper comes out to have a sneak preview of what that conversation looked like, and we'll be hearing reflections from immediately after the event from Emily and Ed. Emily Holmes is an MQ trustee, clinical psychologist and professor at Uppsala University. Ed Bullmore is co-chair of Cambridge Neuroscience and head of the Department of Psychiatry, as well as scientific director of the Wilson Brain Imaging Centre. I took time with them 3 weeks ago to hear their reflections on the event. Let's go straight to that video now and hear what they had to say. So we've just finished the MQ AMS joint meeting with over 70 academics, and Ed and Emily, thanks so much for your time as co-chairs. I want to take the opportunity to hear some of your reflections. Just to tee it up, 12 months ago, a paper was produced by this group in the Lancet Psychiatry, a position statement, if you like, on what the response from the mental health science community should be in light of the pandemic. Emily, why don't I come to you? Could you tell us a little bit more about that original piece of work? What were the driving reasons to pull the group together, and what were some of the recommendations?
Thank you, Lee, and it's been an amazing meeting today. People have been so energetic and put in so much thought and effort. So that piece of work published in Lancet Psychiatry, it's a position piece. It was a collaboration between 24 different authors from a wide range of backgrounds in mental health sciences. So across social sciences, psychology, psychiatry, neurology, and critically, it was also done in collaboration with people who are experts in lived experience in two different ways. And if I may, I'll just explain that, because some of our authors directly contributed with lived experiences, but also what we're very grateful to MQ for in particular is helping us with this survey. So at the time lockdown was first occurring in the UK a year ago, I think in total almost 3,000 people were surveyed about both what they saw as mental health difficulties on the horizon and also ways of coping. So what the paper did was to kind of try and in a very rapid period of time pull together different views, and what we did was try and think about them in the sort of biopsychosocial model. So we pulled out the priorities in terms of brain sciences, as it were, in terms of psychological research priorities, and in terms of social priorities. And what we did was try and look at the acute priorities and the longer term priorities. What we've talked about in the meeting today is to try and revisit those and see where we are now. And I could talk more about that, but back to you, Lee.
Fantastic. And Ed, if I come to you, sort of reflecting in the gap between that first meeting and today's meeting, what do you personally think has changed, or what have you learned around the mental health sciences in that interluding year?
Well, I mean, I think it's worth reflecting that back in April 2020, when we, hurriedly convened this group to produce the position paper, we knew nothing about the mental health impact of COVID. The whole thing was completely unprecedented, unanticipated. And when I look back on the position paper, I'm pleased, I think, that we got one big thing right, which is that for mental health, COVID is a double whammy, because you've got the impact of social restriction, economic disruption, which is going to have adverse impacts on mental health at a population level. And we also highlighted that there were likely to be particular consequences for mental health in those individuals who had become infected with the virus, and there might be either direct or indirect effects of viral infection on the brain, which could have longer term mental health consequences. And unfortunately, I think both of those predictions have come true. I don't think we yet know as much as we want or need to know about either side of the equation, if you will. But clearly we can see, and I mean, I think the Oxford paper that was just published a couple of weeks ago makes the point very clearly that many of the survivors of COVID have got mental health symptoms at a much higher rate than you'd expect following people with comparable experiences of infectious disease or hospitalization. And I think we're also seeing, particularly amongst vulnerable groups, underrepresented groups, that the population impact of the pandemic has been quite serious in terms of mental health. So, I think looking back, I think we got that bit right, at least in anticipating that mental health was going to be particularly impacted in those two ways. But there's still an awful lot more we need to understand.
And Emily, I suppose today's meeting, then 1 year on, was an effort to reconvene an even wider group than the first time, and sort of bring in more experience and more learning. What do you think? One of the questions we discussed today was, what are the gaps for the future and what we need to do about them? What were some of your reflections on the discussions today about those gaps in mental health science and how we tackle some of those gaps?
I mean, the discussions today were excellent. So people brought up a whole range of gaps. So I'm trying to kind of cluster them into themes. One clear gap, which we started to a year ago addressed in the paper and needs a lot more work, is looking at underserved groups, inequalities, and how to meet those needs. And a lot's happened in the last year. So I think that's a gap. Looking at co-production tools with people with lived experience, working out, getting the questions into the landscape that really matter to people and being answered by researchers, that's a gap. It needs to be, the gap needs to be defined by our community, not only of researchers, but people who are experts through lived experience, and that needs to be done together. I guess the one thing that really, really stood out for me today, and I think we all need to think more about, is from a science point of view, we know now a year on that there's been a negative effect on mental health, particularly for vulnerable groups. What we don't know a year on is how best to deal with that at the scale that's needed. And so I think the hugest research gap seems to be from translating the problems that are being mapped out into solutions, into solution-based approaches, into a whole range of languages being used, into interventions, into policies, but something about not only saying how awful it is, but to actually doing something about it. And I think that has to be a key focus going forwards. As Ed says, this is the start of, this is not something that's just going to go over at the moment the pandemic ends. This is the start of work that needs to be done for years to come. And I think I really, really appreciated the comment by Chris Whitty. Chris Whitty at the end of his talk today talked about the long haul, and that not a lot needs to be done in terms of mental health. And I hope what we can communicate as a mental health science community is that things, in particular, things that make a difference, make a positive difference, is what needs to be done.
Great. And Emily, can I follow up on one of your points there? You spoke about engaging experts by experience, or those with lived experience. What are your sort of reflections after today on how we actually do that better? Because I think the idea that it's a necessity is is formulated within the community, but what did we learn today about how we might do that better, or what are the challenges in not doing it well?
From the meeting today, what was really helpful is we had experts from lived experience who gave us a very candid view just before we went into breakout groups, and I think that really influenced the way people thought about it. I don't feel like an expert who would be able to answer this question, but I can see what the issues are. It's how do we do this better together? How do we, as we just did, talk to our experts with lived experience and work out how their questions are being translated into research? But also, how do we do it at pace and speed? Long COVID is an obvious area, an example, but you know, the comments from young people and young people's mental health are absolutely critical. So I guess it's about finding mechanisms and all, you know, and really just encouraging the community to share examples of where it's working, good practice, and write up how that's happened so that we can all learn to do this better. We're only just starting to do it properly. So it's got to be the start of a really serious voyage. And I don't know the answers, but I'd like to keep answering the questions so that we can find people to help the community ask these.
Brilliant. Ed, you're a really strong advocate for that sort of whole mind, body, brain approach. And you've talked before about, you know, COVID being a proof point that approach is needed. And how as a mental health sciences community do we make sure that actually happens? How do we move in that direction?
Well, I think it's a very good question. I mean, you know, I think it's just worth reflecting on long COVID, because that is something that those words did not exist, you know, a year ago. It wasn't something that we had a name for. It wasn't something that we really knew about at all. And it's become very clear, and we heard a lot of it in the meeting, particularly from people with lived experience, that, you know, long COVID is very definitely quite a common sequel of infection. And, you know, it varies, the symptoms vary from person to person, but they're typically a mix of physical and mental health symptoms. And in terms of gaps, you know, one of the worries I have is that people with that complex mix of mental and physical health symptoms are sort of falling between the gaps of the existing organisation of the medical profession particularly, and how mental health and physical health services are organised. And I think, you know, one reflection I would have is that we need to adapt how we're working as researchers, and we perhaps also need to think about how we adapt service provision, so that instead of forcing people to have either purely respiratory symptoms and they see a respiratory physician, or unquestionably neurological symptoms and they see a neurologist, and psychiatry or psychology being the sort of default place for people to be treated if we can't find an obvious medical reason for their symptoms. I mean, I think that's really putting patients through a mill that doesn't always serve their best interests. And I don't think it really reflects what the research is beginning to tell us about how, in particular, the immune response to infection could have implications for both mental health and neurological function. And we really ought to be thinking about this in a much more joined up way. As I said at the start of the meeting, I think one of the, you know, the big wins of COVID, if you will, has been that it has galvanized more collaboration across disciplines and across geographical centres in the UK than I think I've ever experienced before. And I hope we can find ways to carry that spirit forward, and particularly to bring together, you know, ways of thinking about this very complex protean syndrome of long COVID in a way which is more, you know, accurately reflective of the actual experience of having long COVID, and less driven by the way that, you know, we've traditionally organised ourselves in medicine and in research.
So I love the positivity of both of you. Perhaps that's why you were selected as co-chairs for this alongside your credentials. Let me try and frame a more pessimistic view of the world. We know that mental health research funding has been flat in real terms for the best part of a decade. A pandemic comes along. At the very start of that pandemic, you know,
big investment into vaccine and response mode funding. Mental health then got sort of shot in the arm a little bit, if you like, to get there. And perhaps it could be said that politicians and others have weaponized mental health in conversation to hit headlines and to make sure that they're being seen to cover all the bases. What stops us going exactly back to where we were pre-pandemic with an epidemic mental health set of conditions with the same old funding over and over again? What stops that from happening? That's to both of you.
Well, I mean, if you talk to funders, as we have done, I mean, they'll always say mental health is a priority, and it is a stated priority of UKRI, and it's a stated priority of the Wellcome Trust. And I think, we have to take that in good faith. I think, it has moved up the agenda considerably in the last 5-10 years as a priority for funders. And I think we have to believe that if the funders are offered opportunities to invest, they will prioritize those opportunities. And specifically in relation to COVID then, I think the question is, well, how can we as a community help ourselves, organize ourselves to put together the most compelling bids, and they will necessarily be quite interdisciplinary. They will necessarily, I think, be best run on the basis of a sort of national scale rather than the traditional model of different universities competing with each other in a slightly sort of proprietorial way. So I think the short answer is I think we have to believe that the universe of funding is more open to thinking about mental health science than it ever has been before in the UK. That's certainly my perspective. And the ball is in our court to some extent to think how can we organise to be to make sure that we actually get that funding coming through. And to my mind, the answer to that question is partly to not be thinking about a program grant here and a program grant there, or the usual sort of piecemeal, slightly sort of over specialised way of doing research, but to have the courage and energy to find new ways of working with each other across disciplines and across centres to put together really compelling big bids that the funders will look at and say, well, this looks as if it could really make a difference, and it looks as if it's scientifically rigorous, and why wouldn't we fund it?
Right, Emily, your thoughts?
I'm really listening to what Ed says, and I agree with much of it. I think historically, though, there's a need for us to be a bit bolder, because maybe the funders are putting it as a priority, but where in the list of priorities? So if we think even bigger than COVID, mental health is at the top of the global burden of disease. So it shouldn't be a priority. Maybe we ought to be thinking about it as the challenge, or a really high priority that keeps being overlooked in a Cinderella sense, and that's just not good enough. And if we take the phrase that I think is so familiar to our community, but perhaps isn't outside it, there really is no health without mental health. Ed and I completely agree, mind and body are integral. So mental health should be around the table in all aspects of science, all aspects of healthcare, and kind of really aiming to make a difference in our lifetimes. So that requires both an ambition to tackle a global health problem alongside important discussions with funders and looking after our community. Like, I genuinely think, like Ed, like many others, if we want to solve problems, that science and research and collaboration with end users has to be the way to do that. So the scale is huge, and that hasn't been recognised until recent years, really. So I do think we need to figure out together how to address this issue of no health without mental health, and be creative and positive and keep our eye on a big goal.
So one final question for me before I ask for your sort of final reflections and what the future looks like. One of the comments that stood out for me in the meeting today was from one of the young people who were attending. And in a breakout room, she said to me, I just didn't realize there was this much research even going on. It's brilliant to see. And we talked to her about accessing that research, and there were questions to Chris Whitty about how we make sure that research actually gets out there. And yet in an age when the next wave of scientists and the next wave of researchers and those passionate about mental health should be hearing the most and learning the most about it, we've got an age where people just don't believe what they read anymore. How do we, as a science community, better connect with the public and the youngest groups in that public to make sure they're learning and moving on from us? I don't expect a foolproof answer, but what have we got to do better?
Can I just say how positive, like, it just kind of speaks to what I think is fantastic and shone through the meeting today as well, was the appetite of young people and people with lived experience to want to know about research, and how up to speed and how forward-looking people are. So I think, Lee, in some of this is around how I don't, you know, how it's not just the researchers, but how do we get communications working better, and organisations and charities and young people, so that research is out there. And this is not just something left for scientists to solve, but becomes that something that really is accessible and transparent and open for everybody. So I think that's really positive. And
so, final question from me, what's your sort of one big takeaway, personal reflection takeaway from today's meeting that you want to share with the whole of the summit? There will be a full write-up of the event after this conference, but what's your one big takeaway of today's joint event? Ed, I'll come to you first.
Well, I'm not sure I'm going to be able to distill it into one big takeaway, but if I can just sort of break it down into chunks. I mean, the first thing I'd say is, particularly when you look back a year ago, priorities are shifting. They're shifting away from the acute response to the pandemic, and we're ever more aware of the longer term sequelae, and mental health is right in there as a very important long-term outcome. And it's going to take, you know, some years for us to see the full recovery, I think, from this pandemic. So I would say to colleagues who are in mental health science, now is the moment for us all really to be thinking about what we can do to address the longer term impact of COVID. The funders say that they're ready to hear from us. They say that they have put mental health as a priority. And I think we should very energetically think, you know, what can we do? How can we organise? What are the best ways that we can configure ourselves to understand the causes of mental health outcomes in COVID? How can we design new interventions? How can we organise services better? And how can we communicate to with people with lived experience so that we are, you know, more confident that the way we're thinking about things like long COVID really matches the lived experience, and that, you know, as we were just talking about, that young people particularly, and not just young people with lived experience, but actually, you know, young practitioners, young scientists coming into the field are aware of what's going on, that we make that endeavour as accessible as possible and as attractive as possible to people who might be thinking about how they're going to, you know, be planning their research careers over the next several years. So my take-home message would be, you know, now's the time for action by the mental health science community. We called for action back in 2020. You know, I think we could flatter ourselves by saying that was prescient, but now I think it's urgent.
Emily, your reflections, final reflections.
I think my takeaway is going to look a little bit like Ed's takeaway, which is a smorgasbord, all put into this tray to take forwards. And yeah, now is a really important time. And we know that from research already. If problems are starting to build up, it's much better to do something sooner rather than later. And if new conditions are emerging, we understand them now, not later. I think the key takeaway for me, maybe that's different from the last year we mapped the landscape, and it's clear that mental health has taken a downturn. In the future, we need to go forwards looking at change and transformation and solutions. And to do that, I think we need to work together as a community and really be supportive of a joined up endeavour, which may include taking risks, may end up with things that don't particularly look like what we're used to, but encourage each other, just as I hope happens in other areas of science, to develop risks that have gains of really helping and supporting scientists in their careers to do that and serve the mental needs, health needs of the community. So yeah.
Fantastic. Emily, Ed, thank you so much for your expertise, for chairing the AMS MQ meeting today, and for your generosity of time for being with us here at the conference. Thank you so much.
You're very welcome.
Thank you, Lee, and thanks for your support of the meeting.